Hi, this is Dr. Silvestri. I'd like to talk to you about our liposuction program. We've been in existence for over 17 years. I have been with Dr. Goodman for over 8 years. Our liposuction technique and procedure takes about 2.5 to 3.5 hours, depending on how much fat is necessary to remove. So the way it works is you would come in, have your consultation, which is free. Then on the day of your procedure, you would come in, the girls would get you dressed for your procedure. I would come in, mark your abdomen, waist, flanks, let's just say we're talking about that procedure, and take photos. The photographs are so you have before, after, and then every time I see you, I would take more photographs. We also take photos at the end of the procedure. After the photos are taken, the girls will prep your skin with an antiseptic. Then at that point, myself or our nurse practitioner will come in and place little numb areas on your skin throughout, and then using a longer needle attached to a pump, we would pump in the local anesthetic. It's a dilute solution of lidocaine. It has a little bit of epinephrine in it and some bicarb just to take the sting out. After the anesthesia's in, we give you about a 20-minute break, and that's just for the anesthesia to soak in and the epinephrine to take effect in the subcutaneous tissues. After that, we come back and we make small holes utilizing a 2mm skin punch. We make about 5 to 6 on the anterior abdomen, 2 to 3 more on the flanks, and depending on where you have excess fat up in the bra roll, we may put another one on your lower chest just to be able to get an extra angle to get that fat out. Florida has a maximum fat removal of 4 liters. If we approach 4 liters, we will make sure you're symmetrical on both sides. Okay, but at 4 liters we do have to stop. We never leave anybody, however, bigger on one side than the other. After that's done, we have you stand up, we check all the areas. If we need to remove a little bit more fat from any specific areas, we ask you to lay back down and we do so. After that point, we take more photographs. Then the girls will get you dressed in your compression garment. You're going to wear that for the next 24 hours, after which you'll take it off, you'll wash it, dry it, you'll take a shower and put it back on. You'll be seen within a week of the procedure just to check up on you. Usually we're hitting maximum swelling at about 10 days out, after which I will see you once a month to check on all the areas. The swelling will start going down significantly by 6 weeks, and then at the end of 3 to 4 months, we can say that's the full procedure. So that's our technique for subcutaneous to mensa liposuction using a machine that vibrates. It is not electrical, it's not a laser, it doesn't get hot, and it's very well tolerated, very comfortable. We can give you some medications to help you relax, such as lorazepam. Some patients get a little gabapentin just as an added relief. It helps disconnect the nerves a little bit. Most people tolerate this just fine without any adverse effects, and we are always available to you. You will leave the office that day with my personal cell phone, as well as you can get back to the girls. Most of them have had the procedure and they're a wealth of knowledge. Thank you. This is, once again, Parisia Aesthetics. Our number is 561-318-7895. Our address is 2055 Military Trail, Suite 305, Jupiter, Florida. Hope to see you soon.